we wanted to get you in today on our Vidant Spotlight to talk about complex shoulder reconstruction. It is something I hear more. It seems like all the time I'm hearing someone who just had shoulder surgery.
Yes.
So you're a busy guy.
Yes.
But
yes.
what is shoulder reconstruction?
Well, when I was thinking about that, there's three types of people. There's the young 15 to 18-year-old athlete that is too strong for their own body and putting a lot of stress on the shoulder joint. And then there's the middle-agers that think they can do more than they really can, and they start to wear out ligaments and cartilage and tendons, and they're still trying to act like the 20-year-old. And then there's the older folks that, frankly, the joint is worn out. And so there's really three kinds of complex shoulder surgeries. Joint replacement's kind of the end result once you start having arthritis and bone loss and the tendon tears so much that you can't fix it. Then you're looking in more to a shoulder replacement, where that's artificial parts.
Tell us how to prevent it. Is there, you mentioned for older folks, it's deterioration, I guess,
Yeah.
and probably can't prevent that. But
Well, yeah, sure. There's prevention in all age groups, from the little leaguer, to the college quarterback, to the 50-year-old that still wants to bench press 300 pounds. I see all of that range of people. So I try to.
How much of that do you see? A guy who's trying to lift weights more than he should?
I see it all the time.
Wow.
All the time, either in their home gym with COVID, or the gym's back open, and these are guys. Literally, I had a bodybuilder within the last month who was pretty darn cut, for 46. I wouldn't want to tangle with him, and he literally tore his pectoralis muscle right off the bone. So I had to fix that. So, I try to give them activity modification exercises. I try to, bring their expectations down just a little bit, but still allow them to succeed and reach their goals.
Yeah.
But yeah, so just, the right way to exercise, and then there's a wrong way to exercise. And at some point we have to maybe move less weight around with, lower weight and maybe higher repetition, and maybe mix it up and find some other activities to do.
Dr. Phillip Perdue, who is a orthopedic surgeon. And a lot of people know you as the team doctor for ECU sport. People see you sitting on the sideline, particularly at ECU basketball games. But do you see a lot of athletic shoulder injuries from participating in sports? Mostly what you're dealing with most of the time with ECU athletes is knees, isn't it?
Well, there's a fair amount of shoulders, particularly in the football players. They're lifting a heck of a lot of weight, and there's a lot of violent, awkward movements on the football field. So, we'll have 15 to 20 shoulder injuries probably per year on the football team. They don't all lead to a surgery, but we'll have a number of either a dislocation or, like I said, a rupture of the pectoralis muscle because they're bench pressing enormous amounts of weight in the weight room. There are a number of I've had shoulder dislocations in basketball players, college basketball players for East Carolina, high school basketball players, and most of those, when the ball pops out of the joint, those types of dislocation injuries, they often recur. So those people that are high-level athletes that have one-time ball pops out of the socket, the risk of that occurring again is pretty high. And so a lot of those folks that are athletic and pursuing that sport continually, they'll need an operation.
Do you ever, is surgery always the answer, or can you treat shoulder problems without surgery?
Many times. I'll often tell people in my practice, I have to see 100 people before 10 or 15 of them I feel like actually need an operation. So there's many ways to. Some people come in and think they need surgery, other people come in and don't think they need, but I have to see a whole lot of people before I feel like I actually can help them. I don't want to just do an operation until I feel like I can really help them. So there's lots of modalities, therapy, range of motion, exercising, things like that can safely avoid an operation.
So when surgery is the only option, what are the latest? What's the latest in shoulder surgery? Can you do less invasive kind of things now?
Yeah, sure. There's a lot of. I do almost everything that I do arthroscopically. Probably 15 years ago, it wasn't available. So
No kidding.
there are lots of operations I do on the shoulder, and somewhat on the knee, but on the shoulder where, no one would have thought about doing it through the scope in 1995. So there's been a lot of improvement with that. Now, if you're talking about a worn out knee, worn out shoulder that needs a replacement, that still is a replacement, still requires an incision. But the minimally invasive arthroscopic rotator cuff repairs, ligament repairs, people that have had surgery and they come in, they're stiff, they still hurt. Surgery was, say, done somewhere else. That all can be done through the arthroscope, the minimally invasive surgery.
How about recovery and rehab time? What does it normally, how long does it normally take?
Yeah, so rehab generally, depending on the procedure, if it's a rotator cuff, which is not a replacement, that's still a 3 to 6 month recovery. A replacement is 3 to 4 months. So you're talking 3 to 6 months on average for any kind of major shoulder reconstruction. You're not in bed and sitting in a corner depressed. You can move around, you can walk, but generally you would need a sling for about 6 weeks. And then after that, you have a fairly normal life, but you're still in rehab, in therapy.
How about someone that may feel like they need to see someone now? What resources are available to a patient that might have shoulder problems?
Well, they can start with their primary care physician. I would say a number of patients I see have already seen their primary care physician, and they've been referred to me or one of my partners. They can go to the Vidant website. It's a very good resource for being able to find a proper physician for referral. The resources we have here in Eastern North Carolina for primary care is excellent, and we have very good primary care physicians that will start the process of treating and healing the knee or the shoulder, and then at usually the appropriate time, they're referred.
Yeah.
And that's when I'll see them.
All right. Well, it's great to have you in here this morning. Do you do any work at the Children's Hospital? I know we have some children's orthopedic.
We do have a new pediatric orthopedist who is getting ramped up, and we did, of course, our group did all of the pediatric orthopedic cases for 30 years. So so less than we used to. We still do. I still take care of adolescent sports.
Right.
And high school sports, but the pediatric orthopedist, I think, is trying to get ramped up over at Vidant.
Good. Well, it's good to see you.
Good to be seen.
Thanks for taking the time to come talk about shoulder. So I hope I don't need it, but
hopefully not.
I'm more likely to be in your office for a knee problem.
Right. Yeah. Well, thanks for having me.
It's great to see you again.
Appreciate it.
Yeah, Dr. Phil Perdue, the assistant professor of orthopedic surgery with ECU and Vidant Health.